So I know it's so hard to tell people and tell your family, but you really need that support. And I wanted to make sure, I'm a very strong lady, and I've never really asked for people to help, and I think that was the hardest thing, is to be able to be vulnerable and to allow people to be there for you. Was very hard for me and very humbling, and I learned a lot. But I knew I wanted to go in there and be positive. And I think the way I told my children is the best thing I probably could have done. And when I told them that I had breast cancer, the first thing I told them is that on Monday, mommy's gonna be breast cancer free, and we're gonna go through this journey together. And I had to pause, because I knew that was shocking to them, and they had to process it and go through their emotions. But I always told them, I'm gonna get through this, and this is just a process I'm going through, and I'm gonna have my surgery, and I'm gonna have whatever treatments I need to have afterwards to be here for you. And I needed to make sure that they were comfortable with that, and that they were gonna take this journey with me in a positive relationship with me and God, and to know that there was no anger. Again, this is a common diagnosis. I would say, as far as statistics go, 1/3 of all cancers are breast cancer, and more than 30% is breast cancer. That's a really, really high number. So it's gonna happen to a family member that you love, or yourself. So it's really important to understand that we're not alone. And I have had so much love and support from my patients that have come in, and they were able to share their stories of their journey, and I was able to share mine. And I really think that community really helps us be strong, and I want us to be there for each other. This is not something that you need to hide or be embarrassed. There's nothing we did to get this. So it's so important to be there for one another, and I really, really hope that you take that personal message home. I would have these random weird symptoms. I would get ear pain, and I would get really bad teeth sensitivity. It makes no sense. As if you've used a teeth whitening strip for too long. My teeth were always sensitive. And of course, my oncologist said, oh, that has nothing to do with it. Okay, well, I've never had it before, right? So it's always interesting how people poo-poo symptoms, and I think, again, it's about being your self-advocate, right? Understanding. Now, they did tell me that the biggest symptom would be fatigue. And I thought, come on, I've been tired my entire life. This is nothing. What's tiredness? Well, gosh, that fatigue is really real. I would say after I left home from work, I had to do everything I could to get through my day, and then come home and be just utterly exhausted. And I tried to understand why. I asked him, why does that happen? And they said with every study, there wasn't necessarily markers that came up positive to explain why the fatigue was so severe. But then, like, I mean, why would it not be? I'm literally radiating my skin and radiating my tissues. It's taking my entire body to go through this healing process, right? So it's pushing everything out and trying to re-heal all this broken tissue, all these broken cells, everything that I'm doing to it to help my cancer. But my body now has to heal all that. So that makes sense. I think as doctors and medical people, they're trying to find out these what labs went up and what hormones went up. And how about the fact that we are radiating our body, and it takes all of our body to heal it. Every single day we radiate it, we heal, we radiate it, we heal. And believe it or not, when the weekend would come, I'd be so excited because I actually would feel really better by Monday, and then Monday would hit again. But after a while, after my treatments, I was told that the fatigue would last anywhere between 3 to 9 months. I thought, God, that's a long time to feel really, really bad. So I remember the first month I was still exhausted, and I said, this makes no sense. This has to be a mind over matter. And I really believe in all that. I decided that I would no longer say every single day that I was tired. When people ask me, are you tired? Yes, and I decided I'm no longer saying this. And when people ask me, how was I said, I'm wonderful today. I feel great. And after a couple of weeks, you really did start to believe yourself, and it didn't matter that I was tired. I still was gonna function. I still was gonna do everything I could. I didn't wanna give myself that way out to be like, I'm so tired, I don't wanna do anything. No, you know what? It's okay, I'm alive, I'm healthy. Being tired is the least of my worries. I'm still gonna get through my day and do everything I need to do and be hopeful and happy.
So Doc, we've been on this journey with you as your Bella family, both as patients and as your employees, but we really all want to know, where are you now? What happens now with your health? What direction do you have to take as far as your wellness in general? And then what do you have to look forward to as far as any future problems?
Well, I will say, I didn't mention this before, but I was very, very blessed with an amazing staff. Everybody really helped. They gave me my space when I needed it. They called me when I didn't want them to, and follow up and prayed for me. And I truly appreciate that everybody really came together, and that really meant a lot. It's not an easy journey to take. It's kind of interesting, all the different things you really learn and go through. I was taken off my hormones, and being premenopausal, I want to say that was probably one of the worst things they could have done to me. Going through menopause and being forced rapidly through menopause by medications they put you on, man, that does not feel good. It really takes away your memory, your focus, your happiness. It makes you feel depressed and anxious, makes you not be able to sleep well, to have hot flashes. It's not the way I want to live. I talk about all the time, it's not only about the quantity of your life, but about the quality. There has to be something together. And I fight this battle to this day with my oncologist. I don't necessarily believe in the treatments they give us. I truly believe that hormones make us better. God didn't give us hormones to make us bad. So we have to come up with a better treatment plan than to really just eliminate this entire hormone process from women and take away everything and strip us down.
So why can't you have hormones when you...
So my tumor was estrogen and progesterone positive, which means that if I take estrogen or take progesterone, any little cells that went through my body that were cancerous could potentially proliferate somewhere else. And usually when breast cancer metastasizes, it's usually lung, bone, and brain. So could you get another tumor there? So you could. But it's weird in the processes. So there are 3 types of estrogen. There's a good estrogen, estradiol. There's a bad estrogen, which is estrone. And then there's estriol, which you also get when you're pregnant. So they really eliminate my estradiol, which is the estrogen that they can eliminate, by giving you these medications like tamoxifen, anastrozole. And so I've tried them all. I did not have good reactions to them. I had bad reactions to tamoxifen. I had an allergic reaction to anastrozole. And so I started to say, man, what are we doing? So when we did our labs, yes, I had no longer any good estradiol left. They've depleted all of it out of my system, which is important that you need. You need that for good bone health. You actually need that for your brain. You actually need that for your heart. It's so important for cardiovascular disease. And so here I'm saying, we're trying to eliminate my risk of breast cancer, but we're increasing my risk of all these other bad things that we're more likely to die from, like heart disease. And when I showed her on my labs that my estrone, which is my bad estrogen, was 3 times the amount of my good estrogen, I questioned her and I said, so you've eliminated all my good estrogen, but I still have a lot of bad estrogen, which no one wants to do anything about. Does that make sense? In a wellness world, right? I think I need to be on DIM. I need to make sure I block my bad estrogen. Maybe I need to put on a little good estrogen and then block it. I need someone to help me go through this process, because we really as physicians need to try not to treat ourselves. It's really important. And as I talk to my age rejuvenation colleagues and we go through this hormone, and we all are in agreement. I've met many physicians who are in agreement, but not a lot of oncologists. They go only what's old school. Well, the studies from 20 years ago says you can't have it. Okay, we are now in 2021. Why can't I have it? Can we come up with a better protocol? I'll be your guinea pig. I'll be in your trainings. I'll do whatever you want. And they're like, no, this is the way we do it, and there's no other way. So I'm still struggling with that. They say that once you have your diagnosis, you need to have a mammo and ultrasound every 3 to 6 months, depending on what it looks like. I just had my first mammo and ultrasound done a week ago. You have to wait about 5 to 6 months after your radiation because it destroys the tissue so much that they're afraid that they will not see anything. And this is gonna be a journey apparently I'm gonna be taking for a very, very long time. And I always wanna stay positive. They did find 2 new tumors, 1 on each side that are new. I have a biopsy scheduled for next Monday. And again, that will again disrupt my life probably tremendously. If it's positive, I would likely have to go through the mastectomy route. I don't really want to do chemo, and that will just have to be a process that I will have to deal with day by day and figuring out what that process is going to be. I pray that it's nothing. I pray that it's just another fibroadenoma that I just need to follow through, but we don't know. And it's going to be so important that once you've been treated, it's not over. I think most women know that once they have breast cancer, they have to be diligent all the time and getting checked and checked and checked and not waiting.